Remember that time you went to the pharmacy and your medication cost a ridiculous amount of money? Of course you do! It happens all the time in America. Well, some lawmakers tried to do something about it. They wanted to reform these things called pharmacy benefit managers, or PBMs for short. PBMs are like the middlemen of the drug world. They decide which drugs are covered by insurance and how much they cost. The problem is, these reforms just went up in smoke. They were supposed to be part of a big federal funding package, but they got cut at the last minute. So much for cheaper prescriptions. This is a huge bummer for anyone who takes medication regularly, which is a lot of us. We were this close to getting some much-needed transparency in drug pricing. Now we're stuck with the same old system that benefits the big guys and leaves patients holding the bag. Don't worry though, we'll break down exactly what happened and why it matters. Okay, time for a quick explainer. PBMs are like the puppet masters of the pharmaceutical industry. They work behind the scenes, negotiating prices with drug companies and deciding which drugs make it onto your insurance plan's formulary. They're supposed to be saving us money, but it often feels like they're doing the opposite. Imagine going to the grocery store and having a stranger tell you which brand of cereal you can buy and how much you have to pay for it. That's kind of what it's like dealing with PBMs. They have a lot of power and they don't always use it for good. One of the big problems with PBMs is their lack of transparency. They operate in secrecy, making backroom deals that benefit their bottom line, not your health. It's time to shine a light on these shady practices and demand accountability. So, what exactly did these failed reforms aim to do? Well, they wanted to make PBMs more transparent about their pricing and practices. That means no more hiding behind closed doors and making deals that hurt consumers. They also wanted to prevent PBMs from engaging in something called spread pricing. Spread pricing is when a PBM charges an insurer one price for a drug and then reimburses the pharmacy a much lower price, pocketing the difference. It's basically legalized theft, and it's been driving up drug costs for years. These reforms would have put a stop to that, but sadly it wasn't meant to be. Another important reform that got axed was a requirement for PBMs to pass along 100% of rebates to insurers. Rebates are basically discounts that drug manufacturers give to PBMs, but those savings rarely get passed on to consumers. These reforms would have ensured that patients actually benefit from these rebates, but alas, it was not to be. Section 4. Big Pharma wins again. Whenever something like this happens, you have to ask yourself, who benefits? In this case, it's pretty clear that the pharmaceutical industry is breathing a sigh of relief. They've been fighting tooth and nail against PBM reform, and they just won a major victory. Of course, they'll never admit that publicly. They'll trot out their lobbyists to talk about how these reforms would have stifled innovation and hurt patients. Don't buy it for a second. This is about protecting their profits, plain and simple. The sad truth is, our elected officials are often more beholden to special interests than they are to their constituents. The pharmaceutical industry spends millions of dollars every year lobbying Congress. And it looks like that investment just paid off big time. Section 5. What's next for PBM reform? So, what now? Is all hope lost for PBM reform? Not necessarily. This latest setback is definitely a blow, but it's not the end of the fight. There are still lawmakers out there who are committed to holding PBMs accountable and lowering drug prices. The problem is, they're facing an uphill battle against a powerful and well-funded industry. That's why it's more important than ever for us, the people, to make our voices heard. We need to demand transparency from our elected officials and hold them accountable for their votes. We also need to keep the pressure on the pharmaceutical industry. They need to know that we're not going to stand idly by while they rake in billions of dollars in profits at the expense of our health. The fight for affordable healthcare is far from over, but it's a fight we can't afford to lose.